I'm allowing recording. Hi, everyone. So what I'm seeing here is a pretty small group for today. So maybe we'll mostly do a roundtable conversation. Rose, welcome from Canal Alliance. And pardon me if I may not remember, were you with us last time we did this 2 weeks ago?
Yes,
okay.
I was. Mm-hmm.
All right. And then we've got San Geronimo and West Marin Community Services, which is a little group. And then Marin Health and Wellness, is that Kathy Wall?
Yeah, I'm with the
There.
Household Hazardous Waste Facility.
Okay, great. So were you here with us last time, Kathy?
I couldn't attend, no,
No
sorry.
problem. No problem. I think that's going to be fine. So with this small group, I think what I would like to do is, first, I'm going to quickly answer the question that Michelle brought up, is if your MOU and your contract, your agreement is getting stuck in the works somewhere, let us know. I did reach out to Dr. Khoury this morning to let her know that we're noticing some stalling there. And I will follow up with her on Monday if I haven't heard anything back, but I will give her a full working day to maybe respond. So just to let you know, I did kind of try to elevate that concern. I think one of the things that I'm guessing is happening is that as more sites are interested in doing this work and becoming independent, they're trying to grow their team at the same time. They're trying to grow the system. The software itself has been iterated many times in the last couple of weeks, even really with new additions to the website, new information for training and that sort of thing. So it's really constantly a work in progress. Our intention here, and I just want to really be clear about this, is to fully support you to become independent on a timeline that's comfortable for you, but we all recognize that we want that to happen sooner rather than later, and particularly before the winter months are upon us. So hopefully we'll have folks up and running. I'll say October 15th is going to be our kind of flag day for let's try to get everybody's MOU done, get their account set up and all of that. So to that end, what I'll do today, I'm going to zip through the slides that we showed last time, because I know Kathy and others who may not have been with us last week may or may not have had a chance to view that recording. It is a little bit complicated, so I'm going to just review that onboarding process quickly, and then we'll just kind of do Q&A and troubleshoot some of the issues. And we'll talk about ways that Marin County and our testing program can support community sites that are desperate to get testing into their areas, into their neighborhoods. And of course, we have been doing that. We are doing that. We want to be doing more of it. And then eventually we want to be, and the goal of this work is to hand the baton off to you and to get testing available, integrated and woven into our community fabric so that it's just quick and easy. You can get it at the Y, you could get it at the coffee shop, you can get it at the, the activity center, the community center, wherever. That's really what the goal that we're working towards. So let me, is everyone in from the waiting room? I'm sure, Randy, you're probably watching that. And I see some chat issues coming up. So we will start there. So I know.
Let me know when you want the poll. Please let me know when you want.
Yeah, well, we're only polling 2 people. I think, but so why don't we go ahead and do the poll? I know where West Marin is and San Geronimo, but go ahead and answer the poll. So let's do that.
Yeah, we've had some more people. We've had some more people join, actually.
Oh, good, great. Yeah. Let's go ahead and do the poll now. We're just going to take a temperature reading on where people are with their process. So if you can just kind of click on the box that best describes your place in the process, then that will help us to gear kind of how our communications need to be and where we can best target our training and support. Oh, good. We've got folks all across the spectrum, at least one organization kind of in each area of the spectrum. So give it a couple more seconds and then we'll.
Like we have 7 of the 12. Some of us, obviously.
Yeah, so
Well,
some
respond.
of my team, a lot of my team members are listening in to get oriented to this process in case they need to cross cover for other team members, and so that they can be aware of what we're doing. We all need to wear 10 hats over here at Public Health, just like you guys do. So I've got, I'll introduce them quickly. I think you know Matthew Casey from, actually, why don't we can go ahead and finish the poll.
Yes, I'm going to close it. Okay,
Yeah,
there we go.
okay. So sharing poll results, so you can see that we've got 1 or 2 organizations at each stage of the process, all the way from not having started yet, got that in the pre-contemplation and contemplation phase of things, and then all the way through one organization already out in the field testing. So that's fantastic, and that will give us a nice opportunity to have a pretty good conversation there. So when you're ready, you can close out your poll box. I want to introduce the members of my team so you know the names. Matthew Casey is our testing support lead in the field office. And then on the outbreak prevention side, Sin Ojeda is our lead infection prevention nurse, and she's working with me most heavily right now in the facility side. There she is. Hi, Sin. And she is onboarding with us. This is just the end of her almost first month. And she's getting really, really strong coming in for our team. And Cicely, I think you know, is one of our fantastic county leads for division lead and overseeing all the activities in our public health divisions. So incredible strategy and outreach planner and manager of all of us. And who else? And then I have Serena Enger, who's here, and she is one of my key data support individuals and administrative assistant and jack of all hats, and just really fantastic go-to on our team. She's been here with me, working with my team in particular for over a year now. So we've been through it together. So really, really great team, and I'm so glad to introduce them to you. So for my team, I'd like to let you know that the folks that we have with us are representing a large number of community organizations that serve our low HPI and targeted census tract areas where testing resources and other types of community resources are often really low, or they're challenged to obtain those resources. And so we've got some really fantastic friends here with us who have been struggling on the outside to cope with the pandemic and managing their patrons and their clients who often are needing in-home supports or food bank services or community information. And those folks, many of their clients, of course, have been really, really victimized by the social isolation and the other outcomes of the pandemic, aside from those that are direct physical health, but certainly those that are mental and general well-being threats, and also logistical challenges. So we're just really, really happy to have them. And here, Marcia Grant popped in. She is one of our diehard public health nurses. I don't know what to say about Marcia. She knows everything and does everything. So that's what I can say about Marcia. So Marcia will show up.
Don't.
Yes, you do. Marcia
Thank
will
you.
variously show up at any of our events, and really is a wonderful trusted resource for all things public health. I know that she's my go-to girl for a lot of different things. So that's our team on this side. We're all going to be working together to get to a place in our community where we have testing normalized and available at many different sites. I think we're going to need to share experiences. I think we're already seeing, for example, with the shortage of Binacs, that we're going to be resource challenged as time goes by in different ways and ways that may be unexpected. When those things happen, we're going to be sharing resources across our fences, and we're also going to be sharing our lessons learned about how to be strategic in our ability to respond when it isn't as easy as we'd like it to be. So for example, we're already starting to question if we don't have access to Binacs as a point of care test 4 weeks from now, 6 weeks from now, 8 weeks from now, what are we going to be doing? What kind of supplies and support will we be able to provide or direct you to? What is CDPH going to be doing to respond to that situation? And how can we keep that testing available, even though we might be running out of that Abbott Binacs Now product? So those are the types of things that we are doing. Matthew Casey, whom I mentioned, he is usually the one on the end of the test support email, which is now live. And so you'll see that it's COVID-19 test support at marincounty.org. And you'll see that in the slides when we go there. That's going to be your main communication point for getting to us with questions about your testing program. So with all of that housekeeping out of the way, let me turn my camera off and present some slides for you, which will be a review of what we did last week, and then we'll jump into a good conversation. Okay, so gonna ask Randy, can you see the slides okay? And are they big enough for everyone to read?
Yeah, I can
Okay.
see them. I think they're big enough. You could put it, I don't know if you want to do slideshow mode or not.
No, because I like to see where I'm going with things. So
That makes sense. Okay, yeah,
just kind of wing it.
go for it. Yep.
There we go. All right, so here we are. This is webinar number 2. We're going to go back over the introduction, and then we'll go into shared lessons learned. Who's invited? Again, right here we have community-based organizations who are supporting community members, some nonprofits, employers, and others who all can operationalize testing in the community. The benefits, as we've talked about before, helping you to be compliant with the guidance. That's what we're going to help you do. In this way, we're going to support you to have any of your staff members who are unvaccinated, if they need or wish to be tested in order to keep a safe workplace. We want to support that process. We want you to be able to provide rapid tests on site for employees and others, really to keep yourselves and your communities safe. And then many of you, as we already have seen, have an intention to provide testing for those who you serve in the community. And that's really a key part of it. Testing keeps us safe and active. When we test, we're able to more rapidly isolate a positive case. We are more able to quickly identify close contacts and get those close contacts into quarantine. Quarantine is where you go when you think you might have COVID, or we think you might develop COVID, and isolation is where you are when you've already tested positive. So process overview, we're going to provide testing on site yourself. As you know, you need to be operating under a CLIA waiver. This is kind of that key phrase. If you're doing a medical test on site, you are acting like a laboratory in some way. And in order to do that, to fill out those regulations, you need to be having what's called a CLIA waiver. Now, none of you is going to become a testing laboratory. So how do we get around that? The CDPH program that we are working with allows you to operate underneath their umbrella CLIA waiver. That's the big piece here. And in order to do that, they require that you comply with all aspects of the program. Hence, the application process and the playbook and all the instructions are fairly detailed. So when you embark upon this process, it seems a little daunting, lots of steps, can be intimidating. However, we do know that as you proceed through the process and you become confident in what you're doing, it works out very, very well. We have numerous schools and many sites elsewhere that are using this CDPH primary program to do testing, and they are very comfortable with it. So we know you can get there. How does it go? You're going to submit your application. Please make sure you know how to fill that out. Pay attention to this webinar. And if you have any questions at all, stop the application process and clarify with our office if you're not sure how to answer the question. We're going to go over most of it. You're going to sign the MOU, and then you're going to be engaged with CDPH, and then they are going to set up an approval form that goes to Primary Health. Primary Health is the IT system. They're going to send you an email. Once that email comes, you can go onto your account, and then you complete the training and certification, and then you may begin your testing. So step by step. Another point, there are other options out there. Certainly some businesses and organizations will say, that's too cumbersome for us. We want something simpler. We have the funding to be able to hire a testing vendor or something like that. So some employers are doing that. Of course, if you're interested in those kinds of options, you may find out from us, but then you would be paying the vendor at least for the services of testing. But sometimes the fees are quite low. So we are trying to work right now to find out more about those options as well. In the meantime, CDPH is our trusted partner for offering free testing to you and to those you serve. That's the key point here. So when you go online and start to explore this program, there are lots of different pages where you might land depending on which Google term or which box you clicked on. So I have included these in the slide so you can rest assured that you're in the right place. For a general overview, these are some of the pages that you might be seeing. The little twisty ribbon here at the bottom kind of shows how you go through the process. Basically, there's an FAQ that is, this will be a live link in your PDF that you get. You can download this sheet. It provides an overview. Here is a link to the entire playbook. This is a very dense and very detailed playbook that goes along with this testing program. Please don't be overwhelmed. We are going to help you to integrate and assimilate this information in a way that makes sense for your organization. When you're ready to enroll in the program and you're ready to fill out the application, you'll click this link, and that will take you to this page, and you will choose this button, Other Organizations, unless you are a school in a school district. Okay, this does not include little aftercare, daycare programs, or pre-K things. This is schools K through 12 or TK through 12 only. Since all of us here on this show are other organizations, that's what you're going to click. If you happen to find yourself on this page and you want to start the application process, you're going to click this blue box and then go forward. Eventually, you'll get to the application. I'm going to digress for just a moment. In advance of the application, if you want to review the resources and you click on the resource button, you'll be looking at this page. Before you dive into the resources here on the right, where the questions are answered, and all of these are drop downs, you'll want to be sure that you have clicked the antigen box over here by the yellow arrow, all right? That will mean that you'll get the answers that are appropriate for the program you are doing. So that's why this page is here. In advance, I need you to know that your IT platform choice is going to be primary, all right? So when you're filling out your application, the only option you're interested in is the Primary Health platform. CalReady is our state reporting database for all infectious diseases, and Navica is a community-based algorithm for test reporting for those doing at-home tests with the Binax product. It might be used in community settings, and maybe we'll talk about that at some point, but really you're going to choose number one here, primary. So again, if you find yourself on this page and you're thinking, oh, I need to move forward with my application, you're going to be looking for apply for antigen testing. If you happen to be on this page as you start the application, you'll be clicking antigen and confirmatory PCR. So again, you're always looking for that antigen testing as being the primary thing that you're looking for. When you start the application, this is what it looks like. Are you a K through 12 school? No, you're not, so you'll do that. Be consistent here with your name, number, and email. So in the application, please be aware that this information that you put in will be fed to Primary.Health and the portal and will become part of the initial logon process for the very first ever time you log on to that portal. So for example, do not put your name and then your owner's email and then your office desk phone that no one's ever going to answer. Be very careful about how you fill this out. So read these notes that'll be in this slide about what is best. And again, if you have questions, please let us know. For the MOU, what you will need to do is have the financially responsible person needs to be listed on the MOU. But ultimately, your organization lead and your organization email and telephone should be the person who's going to be in charge of your initial testing and process and your account management. Application on page 2, you're going to be checking this box only if you're submitting on behalf of another. I don't think that's the case for most of you. If you have questions about that, you can reach out to us. Most of you will be testing either just your employees and staff. I think it's fair to say general public. We didn't want you to choose a particular age range here because that might take you down a bit of a rabbit hole. So most of you are not testing patients at a facility. So if you're only focusing on your own employees and staff members, you can click that box. Otherwise, please choose general public. CLIA waiver, I have indicated the options that you will be putting in here to create a correct application process. So this is, again, the next page of the application. This is an overview of what the program is going to provide you. In partnership, CDPH is a close partner with Primary. Together, they are providing you these services in order to be able to do testing at your site. CDPH, Dr. Jessica Khoury, is acting in the place of the ordering physician. CDPH is providing the CLIA waiver. They are providing the supplies and the information and the training and the office hours and the support and so on. And then Primary provides all of the management software for actually doing the testing and doing the required legal reporting. Everybody by now, I hope, has seen the Abbott Binax Now card. It's going to get more rare in the next few weeks. Certainly, we hope to find more in the coming weeks. When a Binax test is positive at your site, you are required to perform a PCR test. This is what that little kit looks like, and you will receive training on how to manage that test and how to do it safely and carefully in the field, and that will be part of your onboarding and training process. Why do we do that? One, it's required in the CDPH Primary MOU documentation to do that. One of the concerns that we have and that we are in conversation with CDPH about is the fact that although the Binax testing is guaranteed to be free at this time, there is potentially a laboratory charge for any PCR that you do. Please do not worry. We are going to ensure with CDPH and with Marin County Public Health that none of our community-based organizations who are serving underserved populations or low HPI areas end up with that bill on their desk and being responsible for it. And I haven't found out exactly how that's going to work yet, but I am in conversation with them about it. So there's a resources page, as I mentioned earlier. It has a lot of information on it. Remember to click this blue box antigen on the right, not the PCR box, and then you'll get answers to the drop-down menu. And then when you click the drop-down menu, you'll get these kinds of things that will allow you to pursue further information for your training purposes. Go back to the overview document. You're going to fill out your application. You're going to learn about it, sign your MOU get your welcome email, open up your account and set up your account. When you set up your account, this is where you're going to be clarifying your roles about who's going to be doing what and who has access to which parts of the program. Not everybody has access to the names and results and the protected health information. Okay. So you can have different levels of access for your staff members. Then you do the online training and the required training, and then you do the final evaluation, and then you're ready to begin testing. So in our little poll this afternoon, we found out that on the call today, we have people in all phases of this. So I am going to pause there and share our email for contacting us. And we will, I'm going to close the slides and we'll go to a Q&A. So first, I'd like again to ask those of you who have been through part of the process to share some of your experiences with the others, and then we'll see where we are. And Randy, if you want to moderate the questions or comments just by raising your hand or unmuting yourself, please feel free to join in the conversation. This webinar is being recorded, so folks will be able to review it, and we will be sharing the slide set afterwards.
Are you speaking, Randy? I think you're muted.
And Randy, if you're speaking to us, you're on mute.
Well, that was not good. So sorry. Thank you. We did receive an inquiry from Community Action Marin earlier today that they had submitted their MOU over a week ago and haven't heard back, asking for an update on next steps. And that individual, Chandra, had in fact copied a few people at CDPH, but I don't know if you have any advice for somebody who's in that phase. And Chandra is the CEO at Community Action Marin.
Sure. So why don't you forward that email over to us? You can send it to me directly, or you can send it to COVID-19 test support, and Matthew and I will get it, and then we will try to follow up with that. As many of the folks that I know that have their MOU in and it's been a week or more and they haven't heard back, I would like to move that forward. So do send that information to me. I will try to get it in front of where it needs to be. And I will also try to get an update from CDPH as to, what is the expected time frame for turnaround time now that they are busy getting more applications and more interested individuals, not just our county, but other counties as well.
Great. Anybody out? We know that Michelle and Seamus are in a holding pattern right now, which Dr. Duncan has placed a call about that. Are any others in a phase where outreach to CDPH would be helpful? So sounds like everybody's kind of waiting possibly for the next step to either apply or wait for approval so you can do your training. And then you may have questions at that point. I know Michelle did shadow the testing team yesterday and provided, this is our maybe second or third meeting we've been in together today, but had some good insights and about that experience. And so as others move forward now, of course, Rose and Yolanda have had lots of experience with testing and can share what that's like. But I think that's a great model. And thanks to Dr. Duncan and Matthew and the team for, offering that as kind of a training tool.
So thank you, Randy. I just want to clarify that the process that we use for testing, of course, the swabbing and the test results per se, it's exactly the same. But our testing team doesn't use the primary software platform because we report directly through public health, right? So we just do spreadsheets and we bring it all back and we report directly. So for training on the primary health program where you're using your phone or a tablet, hopefully a tablet, to record the QR code on the Binax card and submit the result properly. That is that kind of that new piece that you'll be learning, especially with the Primary.Health program. For shadowing during a testing pop-up that we do, we are really would be happy to support you to visit us during that time, to come and to be trained so that you're already comfortable and confident using the swabs and starting to learn to interpret the results. It will just make that initial online training for you that much smoother and faster. And you'll get to meet our great field team, which would of course be with you in the event of any actual community outbreak or situation where where additional support from public health is needed. So to that end, we will potentially, Randy, you and Cicely and I and others can look ahead at our field team testing schedule. And when it's appropriate, we could reach out to one or another organizations who want to have their swabbers do some shadowing. And we can say, we'll be at such and such a location on such and such a day. Please confirm. And we could probably accommodate 2 people or so shadowing for those events. So if people are interested in that, maybe you could let Randy know that you have other people who want to learn to swab, want to learn to do their PPE, want to learn to start to read those Binax cards, then that would be a good time to do that. And I think sort of piggybacking on testing, community testing that we're already doing would be a great way to do it. And we do have some sites planned out in West Marin because we're going to fill in for them while Seamus and Michelle get up to speed. And we are doing regular testing also down in Marin City and other places occasionally. So I will put that out there. And Randy, if it looks like there are people who are wanting to shadow those events, let's get together and see if I can work with Matthew and the team to accommodate that.
And of course, Canal Alliance continues to offer frequent testing as well through their program.
Yes.
Seamus, you have a
Yeah,
question?
I did have a question. I know this came up once before in conversation, but we need to secure tablets for ideally, right? Have tablets on hand for once we get going to document that information.
Yes. Seamus, thank you for reminding us. This is an issue. And I don't, Cicely, can we have an offline chat about looking for some grant funding or something that could support some of these organizations who need to buy any kind of tablet, and they can be refurbished devices. You really just need the tablet so you can access Wi-Fi and have a screen to look at the platform. So you really just need an ISP enabled tablet that can connect to Wi-Fi, connect to cell, and use the internet. So not a tall order, but also not free. So do you have any thoughts on that initially? And then we should look into that.
I mean, I think it's a pretty cheaply solved problem with, a cell phone hotspot and a couple of tablets. Yolanda, you can have, people can actually do, I think they can do it. Can they still do it on their own for this primary? Like they're able to do it on their own phone? Because sometimes we have the people do the technology on their own, but of course the staff needs it too. So I think we could definitely look into it, but it's doable. You can get a cheap Samsung tablet for $200 and have it go to a hotspot that's a cell phone. So definitely, doable.
So if you haven't already started, if you haven't already even just priced that out, what a refurbished tablet or 2 might look like, please do that. In the meantime, if we find a resource that is less expensive, we can keep an eye out for that. Again, it does not have to be the latest and the greatest. You are going to be, the functionality of it is just going to be the browser that you have, and security that's on there, but the portal itself is HIPAA compliant. So you have that going for you already. And then that the internet linkage or what have you will be dependent upon your testing site.
Great point. Any other questions, burning questions? I think it's really great too that we have people at all stages of the process, so we can help each other out. So if anybody needs help connecting with those who are at other phases of the process, certainly I can provide those connections if you like.
Hey, Randy,
And-
I have a question. Oh, sorry.
No, go ahead. Go ahead.
Thank you. So sorry I joined the meeting late. I had another meeting and I really wanted to end it early, but it just didn't. And I'm sorry I missed anything. So if anyone does have any questions, Canal Alliance, I have been supervising our testing site since May. We've been providing rapid testing since May. And so far, I think we've tested like 1,200 people already since then. And it has not been, it's been a smooth process, but it's also been a high demand in the last few weeks that hasn't allowed us to sort of give us a smooth process, but it really did help to start early when the demand of testing was much lower. So it allowed us to really learn and sort of build an infrastructure. And I'm happy to, if anyone ever wants to just come down and check out our testing site and just kind of visually see how it works. We'll be here tomorrow on Saturday. I may not have time to walk you through all of it, but you are welcome to just come and see and just, just kind of see the process. And we're here on Tuesdays from 3 to 7, and then on Saturdays from 12 to 4. So feel free to stop by anytime to sort of oversee the site. Currently, we are using volunteers from the Canal community. So all the testing is being processed by community members. So that has been really exciting to train our community to do this testing. And we've also been partnering with Dominican University. They have a service center, and they've sent some of their students who are currently, working in healthcare to just, cover some of their hours. So they're going to be supporting us. But the demand is definitely high. But yeah, it's been a great service that we've been providing for the community. It helped to have the county here last year providing the testing, and that sort of helped us build something. And we have made changes literally almost every week. There's some changes. We see areas of improvement all the time, and we're doing it every single week. There's a new policy, sort of a new way of a new format at our testing site. We just came up with another one today because the demand has been going up, and we weren't necessarily prepared with space of like serving 100+ people. So now we're at kind of like a demand. We're at a point where we're like, all right, we can only serve 100 people. That's the capacity that we have. And so how are we going to manage that? So we came up with a new plan that we're going to practice this weekend. It just gets overwhelming when community is just all in one line. There's not enough space, and everyone's bunched up, and there's not social distancing going on. So this is why we plan on sort of implementing sort of this new format. But yeah, feel free to come by and just check out our testing site.
Yolanda, what are the times on Saturday? Again, I want to put that in the chat.
12 to 4.
12 o'clock to 4 o'clock. And I know Rose and Yolanda, we need to set up a meeting. Rose sent me some time so we can help brainstorm a little bit. But it sounds like you guys are coming up with some good plans for handling the demand.
Yeah, we're trying.
Hard. Dr. Duncan?
Great. I mean, I think a lot of it comes down to figuring out the best flow and logistics for your particular site.
Right.
If you have a picnic table and you're outside with a couple pop-up tents in a field, that's different than being in a small corner parking lot or in between two buildings, or depending on your situation, you have to figure out where people are going to line up, where they're going to test, where they're going to wait for their test results or not. They are going to be getting texted through the primary program. And so I'm hoping that's what's happening with Yolanda's clients, is that they can actually walk away from that crowded space, get that text, and then they know if they need to come back and be retested or get further information and get tied in with resources. So it does take a little bit of time to kind of figure that out. I think many of our sites will be testing anywhere between 5 and 25 individuals. It's very, very busy in the canal. Thank you so much to everyone at Canal Alliance. I remember the days in April 2020 when we were down there. And just with the very first swabs that we had in the county, and those, we've really come a long way, and you guys have been such a great trusted partner, and it re-innovating every time with us according to what was needed. And that's what we do. So fantastic work. And Yolanda, when did you guys start using the primary program for your reporting?
So we had our first massive testing event in March, and we started in March.
Great,
Yeah.
great. So you were one of the first to really start using that platform. And I just want to say kudos, because I know when they built that platform and they launched it, which was right around March, April, May, they didn't have a lot of resources. There weren't, they didn't have the videos online. They didn't have the office hours. They didn't have a lot of things that they do now. So they were able to learn and expand and improve the actual primary platform and the program because of clients like Canal Alliance, who were the early adopters and did a lot of the troubleshooting for many other counties in the state. So we owe you all a debt of gratitude for that.
Thank you. Yeah, no, it was, it's definitely revolved since March. It's definitely so much more easy to process, even just processing the data within the last, within the last month, they've just changed it, made it easier for people to input results. So it's great to, it's been great to actually see, how much they've updated and made it easier for everyone to use.
That's fantastic. Well, I'm going to have to come down and spend an evening or two with you guys on Tuesdays and see it in action. They keep me in the office most of the time, but maybe things will lighten up and they'll let me out.
Yeah, sure. We're also doing, so Mondays, Wednesdays, and Thursdays, we're doing sort of a testing by appointment only, but it's very minimal, like 6-7 appointments a day maximum, and just kind of helps with the demand that happens between Tuesday and Saturday. And so maybe that's sort of a different way that you can implement testing to start small, instead of having like maybe one massive, maybe one like drop-in day, and then the other days just having like, appointment only tests. So that's also sort of helped with just the immediate demand.
That is a really, really great point. So I'm going to restate it. So she operationalized adapting to increased demand by debulking her heaviest walk-up days by creating some appointment-only office hours during the week at other times when they would see a limited number of persons for testing. Elizabeth, did you have a question?
I do. Hi. So at WMCS, we did talk about sort of like a hybrid model for accommodating tests between walk-ups and appointments. And I was just wondering if anyone is using like a reservation software, or are we just doing it old school in Excel, or if anyone has any sort of like appointment tools that they're using.
Michelle, that is what the primary platform does.
Primary does that? Okay, good to know.
Yep.
Okay.
It's an entire testing clinic and results management software program, soup to nuts, everything. So registering your clients, keeping track, setting office hours, allowing walk-ups or not. Those
Okay.
are all choices that you make within the platform, and you can accommodate and adapt as you go. So it's all, you can have people pre-registered by sharing a link It's all comes with that. So you don't have to have anything extra for documentation at all.
That's good to know. Yeah, that's a great question. Liz.
Music to my
Yeah,
ears.
music to our ears.
Seamus and I will probably chat offline on how to use that, but yeah.
Yeah.
Great.
Yeah, it's great. And actually, I'm going to encourage you to touch base with Yolanda, who can kind of verify that and maybe share some insight. But yes, that is the IST platform. The whole platform itself is specifically designed for you to become an organized testing site, setting up either walk-up clinics or clinic hours where you have pre-registered individuals only. You're able to send out messaging to people who are already registered, so there are communication functionalities for reaching out to people who are going to be coming to your clinic. Like, let's say you have office hours scheduled for Thursday, but on Wednesday there's a red flag warning for wind or smoke or something, and you have to cancel that. You're going to be able to message all your registered patients that are going to be coming. You'll be able to notify them through the platform by messaging them as a group. So it has all those functionalities that are going to make it really easy to set up and also to manage that whole process.
That is fantastic. I am very happy I asked. I'm really.
Yeah. And these are
Thank
some of
you.
the things, and I'm sure Yolanda will testify. These are some of the things that they really didn't have when they first opened it up. And you could kind of register people, but it was kind of clunky. And now you've got all this facility to share links and communicate and do group messages, and you can have prearranged group messaging and all of those things right from within the primary platform. Now, of course, I say this, but as I indicated, we don't use this platform. We do have access to it and we can set up clinics, but we haven't really implemented, not at all on the scale that Yolanda has. So her knowledge is really, really critical in this space. And that's why we have this opportunity to share lessons learned.
Great, thank you.
Yeah, and I had a question, within our zone, because I know right now, myself and our Western Community Services in San Geronimo Valley are getting set up here in the process. If people were to come on a little later on, is there like a cutoff time for this
No.
application process? No, it's an ongoing.
No, you mean new?
Like people, other partners in our zone, like if they're a little bit further behind in the process.
Other people who want to do the MOU and the whole process?
Yeah.
Okay.
Yeah.
So to my knowledge, there's no closeout date right now. And we certainly expect this whole program to be running and to be fully supported at least through the end of this year. Now, obviously, Primary is a money-making business, right? They're a new business, so they're not going to want to lose all their clients right away. They're going to continue to partner with CDPH on into 2022. We just don't have total transparency into what that looks like yet and how much of the testing materials are going to be able to be provided free. But we are still going to need testing in the community spaces in December and January and February. I think that's really very, very clear. So we have every intention of trying to keep this moving forward and working with CDPH and continuing to enroll sites that are interested, and especially if they're going to be serving communities where we have particular interest in getting them on board and getting them access to testing resources.
Well, I certainly appreciate you all hosting this meeting because helps folks not make the same mistakes we did in the process of. So yeah, thank you.
Yeah, we'll get you straightened out, Seamus. I'm frustrated that it's taking so long, but we'll hope to get there. Yeah.
I have one more question.
Yes.
Can we play around with Primary before all the paperwork before we get all the stuff through, or are we waiting for everything?
Not really, but once
Okay.
once you have access to your portal, there is
Gotcha.
kind of a dummy test area where you can do a little practicing and figure out how to troubleshoot and do things before you actually will be setting up your first clinic.
Great.
And the CDPH primary team is regularly hosting training office hours and open, you can sign up and you'll have an account manager that you're able to be in touch with, but they'll encourage you to go to the live office hours where you can literally say, this is my problem right now. This is my question. And can you please help me to figure out what the answer is?
Great, thank you. Good to know.
All right, any other questions or concerns before we close? We're moving on towards 3 o'clock here.
I have one quick question, and I don't know if this was mentioned, and I'm sorry if I missed it. But would the county be able to support us with like PPE, gloves, the little testing tubes, the sort of testing holders, things like that, or?
Yeah, so our ability to do that has decreased, obviously, since the time of the intensity of the pandemic, and most of our partners are trying to source some of that on their own. However, we don't want you to go without, and it's absolutely true that if you had a critical need, that we would be kind of jumping in there. So if you don't mind, why don't you reach out to Randy or to my team and let me see what the details of the need are, and either figure out what your resources are going to be or make sure you have access to what you need.
Okay, thank you.
So
It's
CDPH doesn't supply all of that?
I don't think they're sending
Okay.
PPE.
Okay.
You have to
Good to know.
acquire. Yeah, I mean, we've all been tracking down sources for masks and gloves and all of that since a while now. So hopefully people have a line on that. If your use is going way up though, because you're starting to do a lot of testing, and I hear what Yolanda is saying is that the demand has really, really increased recently during this Delta surge. And of course, with schools opening and kids and all of that. So during this time, the county has a very sincere vested interest in ensuring the safety of everyone in that space. So we're not going to have a situation where we're hoping Canal Alliance teams are testing, but that they're in danger of doing that without critical supplies. We wouldn't want that to happen. Well, I want to thank you all for jumping in, and Randy will be communicating you as far as any follow-up for this. I'll let her officially close the webinar, but really my pleasure to support this process. I'm really looking forward to the time when we're checking in and all you have to say to me is, Lael, it's going great. We did 25 last week, or we did 150, and my employees are really feeling good, or just whatever. So I'm looking forward to those days.
And thank you for sharing all your experience and knowledge and your team's experience, and also for offering to reach out your contacts at CDPH to help sort out some of these issues. It's really appreciated. We know all the demands that are on you. I just wanted to close by, I've actually been chatting. There are a few people who have not, this might be their first webinar, the first time they're hearing about this. And I just wanted to put in a reminder that each organization can decide who they're going to test, how often they're going to test, where they're going to test. So as we are, in fact, working to increase community-wide testing, but starting out perhaps with just if there's a need within your client, your specific client, or your staff, it is fine to put in an application and become an approved site through this program for that focus. And if you want to, try out some community days or whatever, that would be great too. But I just wanted to clarify that for the people who haven't yet started the process. And we will, now I have a process for putting this recording on YouTube with the PIO team. And so we'll get this up and send this your way so you can share with others in your organization or others within your community who you think might be interested in hearing about this program. And again, maybe we'll put that email in the chat one more time. It's, remind me again, COVID-19
test support
at marincounty.org. And someone from the testing team is monitoring that email. And you can also reach out to me because I put my email in there as well. So thanks, everybody, and we will work this out. And thanks for sharing your experiences,
Thanks,
Yolanda.
everyone.
Bye, everyone.
Thank you. Bye.
Bye.
Thank you. Thanks, Randy.
Bye, you're welcome.
Bye.
Talk to you later.
Sounds great. Thank you.